eHealth Information Network. Welcome to the Lesson 1 of our AeHIN Academy on eHealth Capacity Building, our lesson on leadership that delivers an eHealth action plan. This activity will give you an overview of our Lesson 1 for this afternoon with our speaker, Dr. Peter Drury. Some things that I have to remind you for this afternoon so that we will well participate in this meeting room. Please focus now on your screens. So some things to remember: our platform, our rules on participation, our program for this afternoon, and a follow-up email. First and foremost, we're now using Cisco WebEx Event Center, and our room number for this afternoon is 863-828-508. Please remember that, and our password will be Manila123 with all caps. Your mic will be muted for the rest of our meeting this afternoon, but you can actively participate by sending your feedback to the session, by chatting your response, and by posting your questions. Send your feedback to the session by clicking a yes or no response, by indicating if the speaker is delivering his or her content too fast or too slow. You can also give your appreciation by a laughter and applause. You can also chat your response by typing your message to the host or to the presenter of the meeting room. And you can also post your questions by assigning the question in the ask space, and you can also type or ask your question to wherever you want to communicate with. Please remember that all questions should be addressed to the host or to the panelists of the session so that our speaker will not be distracted. For our program details, this session will not just run for an hour, but an hour and more. And your questions should be addressed to the host as it arises. Please be reminded that all questions will be addressed by our speaker for this afternoon. So any questions that we have in our meeting room so far, please chat your responses to the lower right of your screen. I hope I am clearly heard in Nepal from Pradeep and from Sriyat. I think I don't have audio. Can you please check that? So I think it's clear. Thank you so much for all the responses. Now I give the first 5 minutes or a little introduction about the AeHIN Academy to our AeHIN Chair, Dr. Alvin Marcelo. Dr. Alvin, you're on board now. Hello, sir. Hello, Dr. Alvin.
Hello, Aliyah.
Hi, sir. Go ahead.
All right, thank you. Thank you very much, everyone, for joining us. Today is the first day of our webinar series, and we thank Dr. Peter Drury for being here and giving us our first of the series of 8 webinars. We had an introductory later on. I'll be sharing my screen and showing you how you can fill up the AeHIN Academy website form, and also how you can answer the quizzes that we will be asking you to fill in as part of your requirements of receiving an AeHIN certificate. Aliyah, I'd like to share my screen.
Go ahead, Dr. Alvin.
Okay. So this is a series of eHealth 101 to be offered by Dr. Peter Drury. We'd like to request you to create an account at aehinacademy.org. You can do this later on after Dr. Peter's session, and I will be sharing with you instructions for taking the quiz. We're using the free and open source Moodle learning management system, and all it requires from you is a valid email account. So if you go to the link www.aehinacademy.org, you will see this link, and we ask you to click on that. And if most probably you don't have an account here yet, so kindly click on the button create new account and fill up the appropriate information here. So make sure you fill in your username, not my name, and your own password. The password must have at least 8 characters, at least 1 digit, at least 1 lowercase letter, at least 1 uppercase letter, at least 1 non-alphanumeric character. Please make sure that you put in the right email address. Also, the appropriate country where you are participating from. Then you will see this confirmation that an email has been sent to your address. We would then request you to open your email account, and you should find something coming from the AeHIN Academy Administrator, and it will contain a link. Please click on that link, and you will now see the eHealth 101 page in the AeHIN Academy Moodle website. Now we're not yet over yet. Over here on the left side, you will see a link on Enroll Me in this course. You have to click on that link. And when asked, and please write it down on a piece of paper, this is the enrollment key. It's AeHIN Academy, all small letters with no space in the middle. We have to use an enrollment key to make sure that we are not overwhelmed by unauthorized people accessing the course. So I ask for your indulgence in taking note of the enrollment key and entering it in the appropriate box when requested. It is AeHIN Academy, AeHIN Academy. Once you do that, you will be asked this question. Just click yes, and we're done. And that's it. I will be recording this presentation again and putting it on YouTube so that everyone who were not able to join today would be able to do so. There is a quiz at the end of the session, which we will activate tomorrow. Thank you very much, Aliyah. Back to you.
Thank you so much, Dr. Alvin, for setting the guidelines and the rules for this afternoon and for the coming sessions. May I now introduce to you our speaker for this afternoon, Dr. Peter Julie. Dr. Peter?
Hello there. Hi, can you hear me okay?
Yes, clearly.
Good. Okay. Okay, and you can see my desktop?
Yes, Leadership Webinar 1.
Okay, thank you, Elia. Thank you, Alvin, and good afternoon, everybody. It's a real pleasure to be with you to start on a series of 8 webinars that I hope will be of use to you. And in my view, the AeHIN has arranged things so that you have got a great opportunity to really understand how, as leaders in your health communities, you can connect the thinking and understanding of eHealth strategies from the WHO ITU eHealth Strategy Toolkit to the practical issues that you have to engage with the different parts of the eHealth ecosystem in your country in such a way that you can move from thinking about strategies and visions to actually getting things delivered on the ground, delivering on an action plan. And the skills that you or your colleagues that you may know directly or indirectly are going to need is really what this course is about. So I hope you find it interesting and useful, and that you will give feedback so that we can learn as we go along together. So let's move on. The first webinar that we have is, as I've said, just part of an 8-part series. And so I hope that this will increase your awareness on how you can support your ministries and your other colleagues to achieve your national eHealth strategy. And at the heart of that is understanding how thinking about strategic issues, planning, developing an architectural approach, understanding the importance of getting the right standards and arrangements for quality help you to understand then, okay, so what skills do I actually need? What capacity do I need to develop so that we can then deliver some real projects and programs to make sure that things improve for the citizens and patients in the country. So I'm delighted that this is going to be part of the AeHIN Academy eHealth capacity building roadmap. And as you will know, if you've been on the AeHIN site and been involved in AeHIN, there's a very helpful description as to what such a roadmap would look like. And this is the basis for this series of 8 webinars. And you'll see that there are 7 stages, and then they're underpinned by some foundations to do with best practices, guidance, standards, and certification program. Now, I have reflected on that roadmap and want to arrange the webinars with respect to these 8 themes. And you'll see, therefore, that the first one, leadership, which is what we're addressing now, is about leadership that delivers an action plan. So it's how do we take the ideas and turn them into things that can be delivered on the ground. So first of all, today I'm going to talk briefly about preparing the foundations, and then look at an example of how to think about the global business drivers. And that provides the starting point for thinking then about the different parts of the eHealth Strategy Toolkit. And what I want to do also is to illustrate some of the ways in which it's important to understand that health services are very complex organisations that are changing all the time and have different feedback loops going on within them. And they cross different sectors. How is it that we can organise our thinking and our actions so that we have good engagement with the issues and with the people that we need to work with to resolve those issues in a sensible way? So that's just the brief background, the context for the course, and what I want to cover today. So first of all, when we think about getting prepared, these are the kinds of foundational issues. So just, I'm sure you're doing this all the time anyway, but just to encourage you, it's always a good idea to keep an eye on a number of websites that can give you up-to-date information. And I've given, as an example, the WHO website that uses well, it's a very good source for getting an idea about some of the current developments in eHealth and other relevant publications, and I've given an example there. If you're thinking about developing eHealth strategies and policies, there are pointers from that site to the policies that have been developed in other countries. So that may be of help to you. And then, of course, at a regional level, you also have a whole range of resources that will be of relevance to you. And if you look at the AeHIN site that I've given there, you will see, as you would expect, links to the WHO ITU eHealth Strategy Toolkit, which we'll be talking about just now, to the AeHIN Health Ingenuity Exchange, which I'll talk more about later on, to some other regional sites such as the Asia Pacific HIS Leadership Forum, the Pacific Health Information Network, and Pacific Association for Medical Informatics, and also a joint learning network. Now, these are all resources that you've got to hand that are relevant in Western Pacific region, and that's really a great benefit to you, I think. And I think compared to many of your colleagues in other parts of the world, you're in a very good position in terms of being able to get your hands on relevant information. So global, regional, but then locally, what intelligence do you have locally? What are your local sources of knowledge, and how do you keep those up to date with what's going on? So best practices, keep an eye on what's happening and use them to keep up to speed with guidance that may be coming available around governance and architectures, for example, or standards, and in particular, those that enable interoperability. And then the last point is, again, to encourage you, and this is what this course is very much about, to understand where you may be able to go to get some relevant certifications so that your capabilities and skills are recognised and indeed can be transferable. So this is just kind of being prepared, laying the foundations for the work that then needs to be done. So that's the foundation. And then thinking about the challenges that face global health practitioners wherever they are. There are many different ways, obviously, in addressing the challenges, but I like this one that comes from the Institute for Healthcare Improvement, because basically it's a simple idea to get hold of. It's not necessarily so easy to put into practice, but the important point really is that we're trying to address the issues of improving patients' experiences of healthcare, including quality and satisfaction, at the same time as we're looking to improve the health of populations, at the same time as we're trying to reduce the per capita cost of healthcare. And if you go to any country, anywhere in the world, the challenge for them, at its simplest, I think, is well expressed in this way of looking at things, that you're trying to improve the experience of the individual, you're trying to act with the individual, but then you're trying to learn from those experiences that individuals have and report on to understand what that means for population health, and at the same time to drive down the ways in which you can provide per capita cost for care. So if you start with that idea, and in a sense that little triangle or pyramid is like a lens. You're kind of looking through things from three different points of view at the same time. And what you're focusing on is not just a health system with hospitals and health centres, but a much richer mix that extends into public health services, into social services, into the community and organisations, and into the workplace, and even into schools. So it's a rich health and care and community ecosystem. And you're trying to think about it from the point of view of individuals and families who, as we all know from personal experience, are actually where most health issues are recognised and cared for most of the time. The definitions of primary care that we use need to be pretty broad. The ways in which we think about integration need to cover what's going on across different organisations, and they themselves, the organisations, need to progressively align their purposes and aims and the ways in which they develop the governance mechanisms. They don't do the same things, but you're trying to align their intentions so that the net result is a much better and more holistic integration of services that help improve population health, improve quality of care, and reduce capita cost. And reducing capita cost is not just a byproduct of delivering quality services. It's a goal to be going after in its own right, as is prevention and health promotion. And if you go to that website, you'll see some examples. They are examples that are currently coming largely from the US. There's some from the UK in there. But I think if you want to just have a simple one-screen model in your mind as to what at the heart of delivering health strategies and the role that information can play within them, this is as good a place to start as any. So I just wanted to try and capture on one slide a good example of how we can respond to global business drivers. Because if we now look at the eHealth Strategy Toolkit, this is basically its starting point. And you'll see that I've put the URL down there. So again, you can go and check out everything that I'm saying to you. And you will see when you have a look at it in detail that it is designed to be a resource for you, for helping you develop or refresh, renew your country's eHealth strategy. And it's well recognised that countries may be in the very early stages of developing their health and information systems, or they may well be quite mature and have got them well established. The same principles apply whichever stage of development you're in. Don't worry, there are things of relevance to you in that toolkit because it provides a framework and a method for developing a vision, an action plan, and a monitoring framework. And you can see those three parts on this slide here. So this really is the overview of the toolkit slide. Got three parts: establishing a national eHealth vision, developing the eHealth action plan, delivering that, and then monitoring and evaluating what has happened. And you'll see there the different steps that are recommended within each of these three parts. I won't go through them in any detail now, but that's what is going to be, that guides the toolkit. If you want the toolkit on one slide, that's the slide to look at. That gives you an idea of the activities that need to go on to develop and use eHealth strategies and to put them into practice. Okay, let's focus a little bit more now on part one, the framework for a national eHealth vision. And you'll see that there are three broad parts to this. First of all, developing the strategic context or understanding the strategic context. And what I've been saying so far has been really all to do with encouraging you to keep up to speed with the foundational information, whether that's global, regional or local, and to pay attention to actually understanding what the pressures are on the health system that you're part of. And in doing that, there are issues to do with population health, the status of the health system as it stands at the moment, the existing strategy goals and priorities, the broader economic and social development goals, and in the context of all that, then agreeing what are the goals and challenges and the implications for eHealth. So if you understand the strategic context, then you begin to understand why it is really imperative to invest in good ICT to support better informed decision-making to address the issues that are of strategic importance. To help understanding to be developed and shared, it's important to create collectively and collaboratively a vision for eHealth and to be able to move from the vision towards clarity about what it is we're trying to deliver, what are the desired outcomes. What are the eHealth outcomes for the health system, and what does that mean for the key stakeholder groups? And we'll talk more about the stakeholder groups later on. So this is why we need to do things. This is what we want to do. Now, how do we go about doing? And that requires an understanding of the different components that are going to be needed. And again, we'll talk more about these 7 components broadly 7 components that are needed to deliver the desired outcomes. So one of the things that we're keen to do in these sessions is to make sure that there's time for you to ask questions of me. And so I'd like to stop for 5–10 minutes or so to deal with any questions that you may have and to see what answers I may be able to give. So I hope this is a good opportunity for us to to deal with that. So, Alia, can I hand back to you?
Yes, thank you, Peter. Any questions from the floor? You can now type it in our chat box located in the lower right of your screen. Dr. Jargal, can you clarify more on the health data dictionary that you are talking about? So while waiting for Dr. Jargal's response from Mongolia, let us hear from Dr. Fazila. Dr. Fazila is asking, where does enterprise architecture fits in the vision, the plan, and the monitoring evaluation process that you have mentioned?
Yeah, very good question. And the answer is attend webinar 3. Because enterprise architecture is going to be very much what is the theme for webinar 3. And it's important not only to have a good understanding of enterprise architecture, but also the governance arrangements that are needed. And that we'll talk about more next week.
Okay, so that's cool. We have to look forward for webinar 3 for enterprise architecture, Dr. Fazila. Okay, so any other questions from the floor that you would like to clarify? How about from Dr. Jargal? How about the components of I think this is components of installing a health data dictionary. So where does health data dictionary fits in?
Okay, but so health data dictionaries are one part of the topics that I will cover in the standards and interoperability session. So now I can give advanced publicity to webinars 4 and 5, because webinar 4 is dealing with standards and interoperability, and data dictionaries are important for that, but the real relevance comes when you want to exchange information from one place to another, or from one system and person to another. And if you don't have consistent defined terms, which is absolutely what health data dictionaries require, then you can't do that. And so both for the purposes of standards and interoperability and for health information exchange, you need to understand and be able to address health data dictionaries. So you'll find out more in webinars 4 and 5.
Okay, thanks, advanced publicity indeed. There's a question here from Vincent John Tumblos from the Ministry of Health. Ministry of ICT of the Philippines. Follow-up question on enterprise architecture. Who owns the EA? Will it be a public, private, or mixed?
I think the answer, I can't give you the answer to that question. I think the answer will be whatever is appropriate in the context of the Philippines. And in coming to an answer, you may, of course, need to pay attention to what is good practice in other relevant countries. I can give some suggestions, and I'll do that when we cover the topic in webinar 3. But I would be wary of saying the answer for you is this, because it's important to understand the context in which you are developing the architecture for the enterprise and the way in which you expect it to relate to the architectures of the other organisations that you're working with. And those arrangements vary quite considerably between countries. So there's no one simple answer, I don't think, to that question, but it's a good one. and particularly in the Philippines too, where you have, I know, a very decentralised health organisation. There will be particular challenges, and so the context in the Philippines where you're fairly decentralised will be quite different to other countries where there's a much more centralised approach. And of course, some countries, like the UK, for example, move between having centralised to decentralised and back again to centralised over time. So even within one country, the answer can differ over time.
Okay, so I think yes, it all depends on the context of where your eHealth strategy is coming from. There's another question here from Dr. Martha Jane O'Malley from the Philippines. All of the required components must be important, but which would be the most essential, or maybe which should come first, and which would be the most challenging?
See, I think the answer to that question is, well, obviously capacity building, but I mean that's just another plug for the webinar series, really. But I think my serious answer to that question is rather the same as with the example that we were giving just now about the triple aim. In other words, actually, you have to try and do 7 things at once. There's no, these systems work best when you've got all the different elements of them working. Now, that's not to say, actually, that each of the components need to be the focus of as much attention as every other one. There's some that will be rather less relevant, and that can change over time. So one of the things that the toolkit says is your strategy does not actually need to address each of the 7 components in great detail, but you need to have considered them all. So again, it depends on the context that you're in the stage of development that your eHealth system has reached as to how you get the right balance of the relationship between them. So that's a nice introduction to the next section, actually.
Yeah, really nice session. The questions are just coming in. Dr. Martha Jane Umali says, thank you. From Dina Ningrum, I believe Dina is from Malaysia. Sometimes when the leader change, or example, the ministry or the president change to other leaders, the health system will change. It also changed the architecture of eHealth. Any suggestion for that?
Yeah, I think. Oh yes, absolutely. I entirely agree with you. And I'm saying this from experience in a number of countries, but from particularly here in the UK. I think actually this is why it is fundamentally important to put the patient at the centre, strategically at the centre of whatever it is you're trying to develop by way of an architecture. And again, another reason why I like the IHI thing, because it does actually start with the perspective of the patient. What, you know, of all that we're doing, what does that actually mean to the individual? And perhaps individual or the citizen is the better word to use in this context than the patient. But because that remains constant. The ways in which we address those issues can change very radically over time. And in the 30 years that I've been involved in health information systems in the UK, I've seen, I would say, about 7 really quite significant changes in approach to the organisation of delivering healthcare. But what has been constant in the 92 strategy, one of the little booklets that we wrote to support that, which I was involved in, was talking about person-based systems. And that has remained absolutely central to the way in which the NHS information architectural approach has been evolving. So I think political changes are a challenge, but at the end of the day, we have to remember that actually we're there to deliver the best information that we can to support the healthcare delivery to individuals, whether they're preferably that they remain healthy, but if they get sick, how do we do that? So I think the short answer is yes, it's a problem, but keep focused on the individual.
All right. This is a response from Dr. Fazila. Long-term vision should be structured and constant. Short-term can follow cyclical of political leadership, but aligned to long-term.
I agree with you. I agree with you. What I'm saying is the long-term vision, the structure for that and the constancy of that is organised around delivering good quality services to individuals. That's the fundamental, that's the core thing. So when we started, and I think this is true in many countries, the information systems are geared to delivering statistics to enable politicians to account for expenditure in healthcare. So they're very aggregated, and you know it's bean counting. You're just counting numbers. Now that has progressively changed, I think, to having a much more patient and persons-oriented focus to information systems. So that is the core constant thing, rather than the high-level aggregation of information. Okay, so I think we should move on, and I'm sorry if I can't deal with all the questions now. If there are any outstanding at the end, I'll try and get back to you on them. But let's move on, otherwise we'll lose too much time. If that's okay.
Yeah, okay. We just reserve 2 other questions later. Go ahead.
Yeah. Okay, thanks. So I'm hoping that this next slide gives a nice kind of introduction to and follow on from the questions that were being asked just now. So it's basically saying that there are a number of 7 basic components to national eHealth strategies. Leadership and governance, we've talked about a lot, and that overlies everything. Developing the strategy and an investment plan, being sure that you've got the right level of services and applications for the stage of development in your health system, being able to support those with good standards that make systems interoperable, and that can only happen also if you've got a technical infrastructure underpinning everything. And none of that can happen well unless you've also got, alongside everything, the right layers or levels of legislation and policy and compliance and testing. And none of that can happen unless you've got a workforce with the skills and capacity to deliver on it. So that's why I say I don't think there's any one element that has to predominate. The balance of them may change over time. The important thing is to recognise that they're all there and need to be considered. Okay, so this diagram kind of summarises, in a sense, the steps for developing an eHealth vision. And in a way, the important thing actually is the shape of it, because it gives you immediately the idea that this is not something that is done once. It's a continual process of development and refinement. So you've got the components that can be realistically delivered, how that affects, what does that mean in terms of the outcomes and the priorities and the timeframes, what revisions are then needed, how do we get the funding to do that? Oh, what a pity, we haven't got as much money as we hoped. Okay, we'll then need to refine the vision, perhaps to scale it back a bit, or to focus it on other areas. And so that cycle continues. So again, that will happen at different speeds and in different ways in different places. And part, I think, of the real benefits that you have in Southeast Asia and in Western Pacific region is that you've got a great network of people that you can share your issues and challenges with. You won't be doing exactly the same thing in different countries, but at least you can share progress with your colleagues and peers in other places. And I think that ability is one that you may not recognise the value of, but believe me, it is a very valuable network to be part of. It can be, you can feel very isolated sometimes when there are some big decisions to be made, and it's helpful to be able to share some of those issues with peers. So I'd encourage you to keep your networks in good working order. Having got a vision agreed, negotiated, etc., then the part 2 of the toolkit is to help you then turn that vision into a number of action plans. And there need to be basically three stages. One to agree some lines of action, the groups of activities or that need to determine what has to be done. You need to be clear about what the quality, cost and resource parameters are that you have to be working within, and then you need to package it up so that it can actually be delivered and implemented. Okay, so easily said, and we'll come back to what that means a little bit more later on, but that in essence is part 2. Vision, turn it into a plan for real action, and then in part 3, the toolkit gives you advice and guidance over developing a monitoring and evaluation framework. So you'll see here, for example, that it's suggesting that there are some indicators that are needed that take account of the different stakeholders that make sense to different types of stakeholders and reflect on the eHealth outcomes and outputs that are relevant to them. That there are a variety of baseline and target measures. So the important thing here is to remember that the measures that you're taking, on the one hand, are measuring where you are now, the baseline, and on the other hand, are clear about what is the target that we're trying to get to. And then it's important to be clear about how that whole process is being managed. So that's where the governance and process measures kick in. Okay, so that is a very, very quick run through the toolkit, but I've given you the URL so you can go and read the whole document online. And I hope if you haven't done that already, you will do so, or at least the bits that seem of most relevance to you. Now, one of the themes throughout the development of eHealth strategies, and something that is reflected in what I'm trying to get across in this series of webinars, is that the health services are best understood as a continuum of different sorts of enterprises. And I'm just going to use 3 slides here that some of you, I hope, will have seen already, because they were used by Herman Tolentino in an AeHIN hour presentation that he gave on the 12th of February this year. And I like them because they illustrate very well some of the points that I think it's important to make. So first of all, health systems are complex. And there, as I've already said, there are much more than just the hospitals and the health centres. So you've got the public health, community, employers and business, the media, and the education sector, for example. And all of those things are related to each other. But the ways in which things are related can be very complex. And he developed, I think, a very helpful slide here, which shows how health outcomes can be affected by things such as cultural context, so things that are indirect, things that are much more immediate, like diet, things that are going on inside us, like cholesterol issues, and the particular conditions that we may or may not have. And the ways in which health outcomes can be affected can be direct or they can be indirect. And you can see that the solid arrows above the line give an idea of what causes what. So you're basically going from left to right, either directly impacting on health outcomes, an arrow going from one box straight to health outcomes, or indirectly because you're going via some of the other stages. And then the dotted lines underneath is kind of the idea of feedback loops. And I just wanted to just elaborate on the idea of feedback loops in the next diagram, because as he said, the health system feedback loop is a complicated business. So here you've got the web of health status and what determines it, directly and indirectly, what causes it and what the impact is, the feedback later on. And that generates a range of data and information and knowledge about what is going on. And you can see how rich and complicated that can be. And that affects the policies and programs that are taken, that are developed, and then the decisions and interventions and collective action that are taken. When it says collective action, I think he might also, or alternatively, have said corrective action, because the policies and programs that we may take may be to amplify changes, to give positive feedback, to make things happen faster or more effectively, to grow the system. So, for example, you would hope that any sort of health promotion or health prevention program would improve levels of health outcome by decreasing the number of diseases and injuries. So there's a kind of a relationship between issues that you're trying to develop with positive feedback and issues that you're trying to reduce or minimize by having kind of negative feedback loops. So, as he says, information systems enable these different sorts of positive and negative feedback loops that drive public health programs and policies. So that all of that then affects the overall health system. So the main point of these 3 slides is to just make the point that health systems are complex. There are feedback loops going on within them, working at different levels between different sorts of systems, whether those are organizational, cultural, physiological, and the ways in which we take decisions as a result of what we monitor and evaluate can be to make changes happen more quickly, to try and amplify change, or they may be on the negative side to kind of decrease change. Okay, let's then. I hope that sort of got that fundamental set of ideas over, because they are really quite important, I think, in terms of understanding how health systems work better, or should work better, with good quality data, information and knowledge systems inside them. So this is the challenge then for national eHealth strategies. And how do politicians, how do health sector leaders, how do eHealth managers deal with these very complex and interrelated issues? Well, one of the things that the eHealth strategy is very keen to make sure happens is that there's leadership coming from the health sector. So getting confirmation that that leadership is there is really important. And it's not just that it's there, it's that it's sustained over time. And that can be really difficult. Ministers of health in many countries are in office for less than a year. And that makes it really difficult to have any real sustained intellectual engagement, actually, with the issues, never mind the impact that can have on the structural decisions that they're taking. So all the more reason why having good governance structures and a good architecture actually underpins the making of progress. So in terms of the governance structures, a model that is useful and discussed a little bit more in the strategy is having a recognition that you've got health sector leadership supported perhaps by a steering committee of informed and knowledgeable people from within the health sector and also perhaps from outside it, supported by a core eHealth strategy project team. And my guess would be that many of you on this webinar will be members of that core eHealth strategy project team. And part of the challenge of the webinar series really is to help you feel engaged and empowered so that you can involve your colleagues in these relationships, whether they're stakeholder reference and expert advisory groups or broader stakeholders or your steering committee, in taking good quality decisions. And if you don't feel confident to do that, what are the skills and capacities that you may need to develop and take up so that you do have that knowledge and confidence and authority. Now, let me just unpack a little bit more the nature of the stakeholder roles, because it is important to recognise that there are different types of stakeholders, and at the centre, I've put on this diagram, and it's from the toolkit, the decision makers, such as the National eHealth Steering Committee. But they are influenced by people who may be advisors or academics from within the health sector, or perhaps from the insurance organisations that may be relevant in your country, the funding and the investment organisations. So the people who have a key influence on the decisions that are made. But then in every country, thankfully, there are many groups of people who advocate particular points of view, and they may be to do with a particular disease or condition. There are the executives of organisations, are certainly people who've got a real stake in what goes on in the organisation of the health system. Insurers, patients associations are other examples of stakeholders that are very readily engaged with eHealth issues. And then there's the fourth category of the broader stakeholders and the general public. And you'll appreciate from the IHI example that I gave that actually the suggestion is that you start by trying to understand what the issues are from the point of view of members of the general public. What is it that citizens actually are experiencing or would like to experience? And that reality check from the ground may be very influential, and rightly so, in thinking about how we can then make the issues that are rather more general when you come to discuss them at a national level, to bring some reality to the decision making. So I think it is helpful to just bear in mind that there are these different sorts of groups, and they each have an important role to play in coming out with some well-balanced policies that can be implemented to good effect. So the approach to stakeholders, of course, will differ. So for the decision makers, these may be, much more formal requests for input and guidance and review, and the eHealth steering committee or the action group may put up a series of recommendations for a decision. The key influencers typically have a much more kind of informal relationship to the recommendations, and they may be in terms of input to them or giving some guidance on how they're developed. And the engaged stakeholders need to be consulted with at the outset of the process, and then kept engaged during the progression of the evolution of the strategy, so that they're kept up to speed and feel that they are being engaged throughout the process. For broader stakeholders in the public, and again, this will vary in different countries, obviously, but there are certainly ways in which their views can be heard, maybe through mass media or online questionnaires or different sorts of surveys. But actually, I think it is important to have some face-to-face consultations. They may not usually be required, but I think the value that you get out of having some vivid case studies from individual members of the public helps keep the whole process grounded in the reality. Of course, many people, in a sense, do that intuitively and informally anyway, because they're thinking about their own circumstances or their family or relatives. But it is, I think, important to make sure that there are appropriate ways deployed to engage the stakeholders in the public. And then, importantly, the communications plan that needs to be developed has to articulate what the different parts of an eHealth strategy will mean. And managing expectations is hugely important in this. Typically, it feels like an uphill struggle most of the time, and then all of a sudden, it's suddenly seen as being good news, and maybe a minister or a prime minister will stand up and want to say something very important. And typically, they will then take quite an aggressive stance on this and want to make a very high-profile announcement, so everybody's expectations are very high. And the reality, of course, is for all the reasons of the complexities of healthcare that we've just been talking through, actually to deliver this can take a lot of time and is difficult. So managing the communication so that the expectations of politicians, of health service managers, of suppliers, of insurance companies, of patients and the public, and importantly, of the media themselves, making sure that communications plan is well thought through, delivered and kept up to date is really an important part of the whole process. So just to summarise then, in terms of the development of action plans, broadly speaking, there are 3 stages to doing this. One stage is concerned with managing the process, making sure that the leadership and governance arrangements are sorted, making sure that the required skills are present. So you'll see in the way I just underlined it there, that actually right at the heart of delivering eHealth is leadership, governance and capacity, making sure the required skills are present. And then in terms of engaging with the stakeholders, you've got to engage with them. So how is it that you are going to make sure that you've got the skills and understanding of the issues that your different types of stakeholders are themselves interested in, and that you can explain the issues in ways that will involve them and enable them to give you good feedback that can be taken forward. So from these 2 steps, we're looking at developing an action plan that can be implemented and some pragmatic actions that the stakeholders are supporting. Right? And then the third part is actually the bit of developing the eHealth action lines themselves. And this is therefore to do with the main action lines and activities, the change and adoption activities, dependencies and risks, and what is it that you're going to do to deliver on each of the major strategic objectives. Like, for example, and this is an example actually that uses quite a nice case study in the toolkit, the development of a unique identifier. Or it could be that one of the issues is a health data dictionary. Yeah, so what is it that it needs to be done to develop the action line to deliver on that? So that's a summary, again, rather quickly done, of the eHealth strategy framework, three different parts of it, and paying particular attention to, on the one hand, the complexities of health systems anyway. Secondly, looking at the different types of stakeholders that there are and the different ways of engaging with them, so that you can come up with some action plans that can really be delivered, because that is fundamentally what the leaders of the eHealth systems in any country have to deal with. That is fundamentally the task. So let me stop there, and we'll go to our second Q&A session, and more than happy to take any questions that you may have.
Okay, thank you so much, Dr. Peter. There are a lot of questions in our chat box since you started speaking for the second session, and let us address this quickly. So from Roy Consulta, relative to the eHealth toolkit designed by the World Health Organization, is it mandatory to follow what is stated in the toolkit? If not, would you may find any consequences of not utilizing and following the toolkit, which is based on best practices? Thank you very much.
Yes. No, the short answer is no, it's not mandatory. The intention is to give guidance that is helpful. And I think that one of the most helpful things, as I've already alluded to, is being able to share progress and problems in implementing eHealth strategies with peers in different countries who will be trying to do the same thing, but struggling with similar issues, but in a different context. And I think if the WHO ITU toolkit is used as a kind of a baseline for the discussion, it gives you a stable reference point to refer back to, then the way in which you in your country or your network of peers can have a conversation about what does implementing this bit of the toolkit mean in our context, and we found this very helpful, we did it this way, that seemed to work, that did not seem to work. Those sorts of conversations, I think, are quite a pragmatic way of taking some good decisions about what to do next. So again, I don't think there's any sense in which it is expected to be mandatory. There is certainly an expectation that the World Health Organization has set that countries will have eHealth strategies, and there's some targets for the numbers that should be in place by 2014 and 15. But that's not mandating any individual country to develop one. But it is encouraging World Health Organization and in Geneva globally and in the regional offices, which is why Mark and colleagues based out of Manila have been very active in trying to get within the Western Pacific region a real engagement and understanding within and between different countries. That I think is the right way to proceed. So I'd encourage you to keep engaged with each other and use the WHO toolkit as an important baseline for your considerations.
Thank you, Dr. Peter. I think the key word there is not mandatory, but engagement, wherein we can use the WHO ITU toolkit as a baseline for starting the discussion and arriving at solution. So
yeah,
our next...
Can I just add one thing to that? You remember that when on this one of the early slides, I gave an example of the global resources, and one of them was to point to the eHealth Observatory, and I mentioned that there are a number of policies available there from other countries. Personally, I think the WHO toolkit should not be seen as a static bit of guidance. It itself needs to be kept up to date, and the way it can be kept up to date is if people use it and then share what they found useful and what they don't find useful. So, you know, I would encourage you to give feedback on the toolkit itself and how relevant or not relevant it's been for you back to Mark in the Philippines and through him to WHO Geneva.
Okay, thank you. Thank you so much, Peter. Another question from Ayanthi Howardena, failing of the electronic health information systems is mostly due to negative attitudes of the staff. How can we as health managers face it?
Yeah, good question, and I agree, and it is a real challenge. It is a real challenge. I think, in my experience, people like to see success. If you can demonstrate success, that usually is quite impactful in changing people's minds about things. So that's why I, on the one hand, am keen that people understand policy and strategy. But on the other hand, I'm also keen that people can see real results from this, which is why part of the solution to this within any particular country may be to agree broadly what the national e-health strategy will be, and then to capitalize on the particular parts of the health system where it may be easier to demonstrate success, so that you have some places of relevance within the country, preferably, where you can point people to. So I think being able to share localized best practice is usually much more impactful than sharing international best practice. But it can be a challenge to get the local best practices set up in the first place, which is another reason, I think, why it's important to try both to share issues and problems and best practices internationally within a region or across regions, but at the same time to try within your region, within your province, within the country that you're in, or within the kind of the informal networks, to try and maintain good working relationships with staff, because somewhere there is likely to be, for whatever reason, some people who are actually really quite interested in this and will take the time and the effort to try and do something constructive. And you have to kind of have good enough networks to know who they are and to be able to identify them and to be able to help nurture them and support them and give them the skills and the capacity building that they need, because it's when you have local champions that you really make most progress. And it is also very helpful if, in the context of developing and delivering a national strategy, you can have local champions becoming part of that process. So, for example, and this is an example from about 20 years ago in the UK, when we were doing the Information for Health strategy in 1997. The way we did that was to get a chief executive from one of the two NHS hospital trusts. So they weren't trusts in those, NHS hospitals, who was very interested in electronic patient records and had got a really good organisation up and running. And he came and led the program. And what he brought to the process was a personal, in-depth understanding of what it was that got clinicians and pathology technicians and radiologists and ward sisters actually wanting to use information systems, because in his particular hospital, that was what they'd been able to do. And he carried a lot of weight with his peers nationally in the UK, and we got very good engagement with a whole range of stakeholders, both management and clinical. So again, you'll gather from my response, I don't think there's a simple answer to this, but pay attention to your local networks of people who are interested, make use of best practices nationally and indeed internationally. And whilst there are real challenges in dealing with people who aren't interested, pay attention particularly to those who are interested and use them to convince those who are not so interested. So I hope that's helpful.
All right. So thank you for answering that question. There is another question from Dr. Sambath of Cambodia. I would like to clarify a few things in terms of eHealth and ICT and health informatics. What are the components of eHealth in an eHealth plan? And are there any experiences on costing tools for national eHealth strategy implementation?
Sorry, that was a question about components and costing. Alia, was that what you were saying?
Hello, yes. What are your recommendations for eHealth costing tools for national eHealth strategies? I think he's talking about how to quantify the costs of an eHealth plan.
Yes. Well, I think the recommendations that I would have would be to again, this is true in all of these issues to do with eHealth. There's no, in my view at least, no one simple answer that says, do this, this is the magic bullet. I think so far as questions of costing in eHealth are concerned, there are some studies that have been done of the costs and benefits of eHealth solutions. And it's important, I think, to be able to get access to those and to make use of them and to reinterpret them in your local context. But typically, they depend upon either external studies having been done for a particular purpose, or they'll be the byproduct of well implemented costing systems that are in the particular health ecosystem. And the important thing, I think, is to make sure that if you don't have good quality already, if you don't already have good quality costing systems in place, and there are many different sorts of those, and they will vary between country and you know, are affected as to whether you've got essentially public provision or private provision or mixed public-private, the role of insurance companies. Now, all of those things affect the actual costing systems that you will have in place in your country. If you don't have those in place, at least make use of some of the international literature on the impact that eHealth can have in terms of costs and benefits that is available from the international studies that have been done. There have been quite a few done in the UK and in Europe and some in the States for sure. And they then at least can be used to get the interest of people locally to say, well, that is relevant to us, or it's completely irrelevant, or, well, if that's what they're able to achieve with this sort of level of financial information and costing, perhaps we should be adapting what we've got locally to do something similar. So I'm sorry there's not a simple answer that says use this particular system. I don't think there is, but take an intelligent view about what is being delivered currently locally, make best use of what's available from your peers in other countries and from the international literature, and use that understanding to inform better practice being developed locally.
Okay, so that's it. We get that point that there is no absolute tool which can be used for eHealth costing, but the thing is there are freely available opportunities for us to evaluate eHealth strategies by participating in national discussions on national eHealth strategies. So we have 3 other more questions from Rezwan Akhter from Bangladesh. How do you address the challenge of involving the private sector in the national eHealth strategy? Any suggestion of on how to strategize enabling the government to bring everyone under the same umbrella?
Yes. Well, the private sector are another stakeholder, and the size of that sector will vary very considerably between different countries. But in principle, they are just another sort of stakeholder. So I don't think I would be treating them any differently. In other words, typically for the purposes of developing eHealth strategies and engaging with stakeholders, you can't involve every organisation. Part of the effort that the planning team needs to put in is to work with the associations and the organisations that represent the private sector. So, for example, if you take the IT community, for example, there are so many different suppliers of computer systems that may be relevant to eHealth, but they usually will have an association or an organisation within a country that they have set up themselves because they want to have an effective body to make their particular sector's voice known, whether that's for eHealth or for lobbying the government for a whole variety of other sorts of purposes. In terms of the private sector hospitals, most countries, I think, have an organisation that will represent the interests of the private hospital, the private health sector. And if there isn't such an organisation in place, then one of the tasks, I think, is to try and encourage such an organisation to come into existence. I hope that helps. Elliot, I'm just conscious we've only got 5 minutes. So I think if it's okay with you, I should just go through the last 4 slides that I've got.
Okay, that's fine. We just have remaining 2 questions after your remaining slides, and we're good to go. Go ahead, Peter.
Okay, thanks. Good questions, though, by the way. Thank you very much for them. Okay, so some of you may have seen me use this slide in the introductory session, but it's just one slide really that kind of summarises what I think we're trying to do. So if you imagine the eHealth building, what are the skills that are needed? Well, and we'll talk about this more in the next session. So there's one standard that's looking down from the top, rather like the roof on a house, that is really kind of the executive board view about what's needed. COBIT is a whole set of governance arrangements that kind of help you understand what is actually needed and how things need to be organised. All of that depends upon there being good foundations in place, and that's where the process frameworks like ITIL and PRINCE and so lay the foundations for enabling a structure like a house to be built. But that requires an architecture, and that's why it's also important to look at things like TOGAF and Federal Enterprise Architecture. We'll talk about more in the webinar after that. But really, the purpose of all this is to enable us to have not just one, but many different sorts of houses filled with all sorts of different types of people, all sorts of different conversations that they want to have with each other, and to enable them to do that. And so that's why we need standards and interoperability to enable people and processes to communicate. And as eHealth specialists, our task really is to try and understand what capacities do we need to enable all these different types of things to happen, so that at the end of the day, it is people, whether they're citizens or patients, or indeed workers in our health sector, to get the information they need to be able to communicate. So that's a kind of one summary slide. Now, these are the 10 questions that I have given you that I hope are reasonably straightforward to answer. They're all based on what I've been talking about over the last nearly 90 minutes. And Alvin has given you the instructions for being able to answer these and the procedure that you need to go through. Alvin, I don't know if there's anything else you want to say at this stage about this part of the answering the quiz. Alia, do you want to just unmute Alvin? Yeah.
Dr. Alvin, go ahead.
Yes, Peter, I'm okay. Everything's okay. Thank you very much.
All right. Okay, so I hope the participants feel comfortable to answer these questions and know what the process is. So I hope that gives you some questions to reflect on what I've said. And we've actually discussed this quite a bit over the course of the last 90 minutes, the trailers for not just webinar 2, but indeed the other one. So webinar 2 next week, this Friday rather, is talking about institutional readiness, what enables good governance, policy, oversight, procedures and controls to ensure eHealth success. So I very much look forward to being able to take the conversation further with you on Friday. And so now, if there's any final feedback from you or any further questions, then let me deal with those very quickly now.
Yes, to everyone, I'd just like to remind everyone to go to AeHINacademy.org and create their accounts, because the quiz will be offered inside the website. So those questions that Peter posted will be in the quiz section of the AeHINacademy.org. Thank you.
Okay, so thank you so much. Can we still answer a couple of questions shortly but sweetly? There's a question here from Jude Tayabin. Relative to on the 3 stages of action, what would be the timelines of each stage, and when do you know if you need to proceed to the next stage?
I think, excuse me, I think it's easier to answer the second part first. So I think in terms of the timelines for taking action, what needs to be done will vary depending on the type of issue and the complexity of the health system that you're involved with. The important thing is that you understand the overall time frame within which you've got to take your decisions, and in particular when you have got the right answers or acceptable answers to the questions that you've posed. So again, there's no one right answer for doing this, but in essence, agree how you will know when you've answered the question. When you come to that point, move on to the next stage. But in framing how long those stages take, understand how they fit within the bigger picture of developing and evolving the current phase of the eHealth strategy. So some countries take like kind of a 90-day framework to do the whole process in. Others will, because they're perhaps rather more complex, take a year. It depends very much on the context.
Okay, so thank you again. It still depends on the context. There's a question from Dr. Fazila. eHealth leadership can be at ministry level, national level, and regional, perhaps for AeHIN for Asia, and global, perhaps for WHO. Global leadership is helpful in steering countries in putting eHealth on the radar. So I think this is a comment from Dr. Fazila.
Thank you.
Okay. We go to another question from Vince Tumlos. This would be the last question that we will have. In national strategy development, which role best suits the Ministry of Health? Will there be a conflict if the ministry will serve as a decision maker rather than will there be a conflict if the ministry will serve as a decision maker and implementer at the same time?
Well, what do you think I'm going to say in answer to that question? I think probably you would expect me to say, well, it depends. And it does depend. You know, there was a question asked earlier on about, or an observation made about the way in which when ministers and governments change, so the whole philosophy of government can change. And that is absolutely true. Broadly, the rule of thumb is that the ministry takes responsibility for the delivery of healthcare in the country. So the Minister of Health is accountable. But the way in which those accountabilities are discharged can vary very much. And in some countries, they will take at certain times, they will take a very centralist approach, and they will decide and deliver on pretty much everything. So, for example, in the UK in 2001, we had a very centralising approach, and actually what was to be delivered in the NHS was the subject of major national contracts. And for a whole variety of reasons, things changed so that now we have a completely decentralised approach. The ministry is still responsible for the quality of healthcare and e-health in the country, and is accountable to Parliament for that. But the way in which those responsibilities are delivered have changed completely. But what I would say is that despite the struggles that we've had in the UK, nevertheless, the importance of keeping the citizen at the centre has remained. So, again, to come back to the discussion we had earlier on in the webinar, it is important, I think, to try and keep sight of the fundamentals that don't actually change, and let the ministries do whatever the ministries need to do in the local context.
Okay, right. Last question from Dr. Raymond Uy. I believe that the relevance of this question is on the academic requirements for being a competent leader in conceptualizing eHealth strategy. So what are the academic requirements to be an effective or competent leader in conceptualizing and implementing eHealth strategies?
I think to have subscribed to this webinar course and got the certificate of completion, but seriously, I don't think there's any one thing that they can take. I think that there are. Yeah, it's a good question, really, because there is no single answer to it. I think again, we have to try and encourage people to be aware of good practice and be aware of what best practices elsewhere. No decision maker, no leader, no minister likes to be shown up by their peers. And it's important, I think, to make sure that we know what best practice is and to celebrate, actually, those ministers who are influential in eHealth. So, for example, in Estonia, the Minister of Health made a huge impact in articulating the need for electronic patient records in a public conference by having the confidence in his own ability and in the system's ability to pick up a tablet computer and share his own personal eHealth record. So that skill and capability had a big impact, I think, on his peers. And so amongst ministers of health, certainly in Europe, there is a bit of a folklore that's evolved around this particular person's skills and abilities. And the eHealth community, I think, needs to look out for those sorts of champions and make sure that their messages are widely shared and understood, particularly by those for whom there may not be the time to take any kind of formal course, but who've got the ability to understand the importance of eHealth and to take some practical steps to be able to engage with the issues and demonstrate their competencies.
Okay, so I think we have covered all the questions. If we missed anything, please free to email AeHIN, the AeHIN Secretariat at secretariat@aehin.org. Thank you so much, Peter, for the session on leadership on eHealth strategies, and we hope to see you all on our next meeting this coming Friday. That's May 9, same time, 3 o'clock. Manila time, or 15 UTC GMT +8. So this is Alia Evangelista together with our AeHIN Working Council members and Dr. Peter Drury. Thank you so much for being with us this afternoon. For all the questions, please email us, and please visit your emails for our follow-up notes on how you will be able to create your Moodle account and how you could access the recording of this meeting and the quizzes. So thank you so much, Peter.
Okay, my pleasure. I look forward to Friday.
Okay, thank you.
Okay, thanks. Bye now.